my name is Brenna Biggerstaff. This is my introduction video for Clinical Pathology 2. I work at Rockwall County Vet Clinic. I've been working here for about a year now. And we are a 5-doctor general practice hospital, so we see everything from annuals to puppy vaccines to sick patients and everything like that. Today I'll be doing the monthly rinse for our ProSite machine, which runs our CBCs. You do it once a month, and the computer kind of shows you, it tells you when it needs to be done, so we need to do that today. So I'm going to press Run Monthly Rinse. Okay, and then it kind of walks you through it as you go. So what we're going to need is 2.5 mils of bleach, Clorox bleach, and then 1/2 ml of distilled water. And we've got that here. We'll take out the old blood that we were running earlier. And then we've got our EDTA tube. And we'll do the 2 mils of Clorox bleach into the tube.
Overall, she looks great. She got a little bit.
Alright. And then you get your 1/2 ml of distilled water, and you put it in there. And then all you do, put the lid on, you'll invert it a few times, 4 to 5 times, take the lid back off, and then you'll just start it. And it takes about 25 minutes. So today I'm going to be drawing blood from the cephalic vein for a heartworm test, so I only need about 4 drops of blood. So I've got my sterile needle, and I've got my alcohol. So what we're going to do is we're going to kind of take the leg. Kaylee's already holding off for me. I feel the vein right here, for lack of a better term. It feels like a limp spaghetti noodle. So I'll put some alcohol on it to kind of clean the area off. And I've got my needle. I'll uncap it. I'm going to put my thumb right here next to where I felt the vein to kind of stabilize it. And I'm going to go in at about a 30-degree angle with the bevel up. And then just draw back. And I'm going to hold off so the vein doesn't blow. And then to recap, I'm just going to scoop my lid back on, and then we're good to go. So today we're going to be doing our blood smears. So we've got our fresh blood that's already been in the EDTA tube, so it is not clotted anymore. And we've got our 2 microscope slides. And so what we're going to do is just on our first microscope slide, right in front of the little frosted tip here, we're going to put a little bit, like a little baby drop of blood, just like that. And we're going to hold it with 2 fingers while we take our other slide and slide backwards on it until it fills up about 3/4 of the way. And then we'll push it forward, and it kind of makes a little feathered edge thing. And we're just going to let this dry for about 5 minutes, let it air dry until it's perfectly normal so we can go ahead and stain it. So now that we've let our smear air dry, it's completely dry, we'll go ahead and use our 3 diff quick stains. So first we've got our fixative, which is our 95% methanol solution. So we'll just put our sample in there and let it sit for about 60 seconds. And then we'll do the same with the other 2 stains, but for about 30 seconds. So I've already moved it over. It's been about 60 seconds in the fixative. So now we're in our number 2, which is our eosin buffered with acidic pH, which stains our hemoglobin and our eosinophilic cells in the thing. So it's already been about 30 seconds. Kind of let the excess drip off the side here. And we'll go ahead and put it in our number 3, which is going to be our more basic stain, which is our methanol blue. And so this is going to stain the leukocyte granules. And so we'll let this sit for another 30 seconds, and then it'll be ready to read. So now that we've got our blood smear all stained, we're going to take a look at it under the microscope under the 40 power. And there's 3 different levels to the smears. There's the thick part, and then the more spread out part, and then the feathered part. So we're going to go right in the middle. And the easiest way to find it is to start on the feathered and then work your way in to where they're evenly spread out. So I'm seeing lots of red blood cells, lots of neutrophils, which are the white blood cells. There's a few acanthocytes, which is when the red blood when the red blood cells have like little spikes on the edge of it, and that's typically just from misuse while handling, or was something kind of happened post sample. So, but
And said for colitis.
this seems like a pretty normal blood sample, pretty normal blood smear, and I'll have my doctor take a look at it after me just to double check that there's no abnormalities, but for the most part, I'm just pretty much seeing red blood cells. So today we're going to be doing the PCV test, the packed cell volume. So what we're going to need is some anticoagulated blood. We have our micro hematocrit tubes. We've got a TB syringe to pull out the blood. And then we've got our little centrifuge here, and we've got our clay stoppers and our PCV reader. So what we're going to do is we're going to go ahead and pull up a little bit of this blood. And then we're going to take one of our micro tubes, and you can see the little red line there. So what we're going to do is we're going to do the red line on the outside, and we're just going to kind of stick it in the blood a little bit until it goes all the way to the red line. And we'll put our finger on it to stop it. And then we're gonna push it into the clay. We'll open up our centrifuge, put it in, and do the same thing with our other tube. Kind of push the blood out a little bit. I'm making a little bit of a mess, but that's okay. And get the blood all the way to the red line, stop it, and push it into the clay stopper, and put it directly across from the other tube. We've already got our parameters set, so it's going to be spinning for about 3 minutes. We'll shut it and press start, and then wait 3 minutes. So now that it's done spinning down in the centrifuge, we're going to take our sample out, and we've got our fancy little PCV reader right here. So we're going to line the bottom down where the clay starts and the red blood cells are. And so we'll kind of figure out where it separates between the packed red blood cells and the serum at the top. So it looks at about 40%, so pretty good.